whenever there is tightness of the iliopsoas, as the iliopsoas is comprising of three muscles, that is the iliacus, the psoas major and the psoas minor. Although they have different attachment sites, but the insertion site is at the lesser trochanter. The psoas major and minor have the attachment from the transverse processes of the lumbar region. Because they have the attachment at the lumbar region, so whenever there is tightness, the subject will have exaggeration or accentuation of the lumbar lordosis. As the psoas will pull, so it will pull the lumbar region for more lordosis. Exaggeration of the lordosis will be present. So in order to check for the length of the iliopsoas muscle and to differentiate between the iliacus and the psoas, we have to perform this test, that is called as the Thomas test. The subject is asked to stand at the edge of the couch, then flex your left side hip and the knee, hold it, the fingers are crossed, hold just anterior to the knee joint, and then ask the subject to lie down straight. Take it further, flex it so that the lordosis will be neutralized, and then we observe from the lateral aspect. In this position, I am checking for the length of the iliopsoas of the right side. So once he has flexed the left side, the hip and knee are flexed and taken towards the chest, we have to observe the lateral aspect. For a normal subject, the long axis of the thigh should be parallel to the couch. If it is found to be elevated, say it is elevated here, that means there is tightness of the iliopsoas. But as per him, as it comes parallel, so there is no tightness of the iliopsoas. If there is some kind of angulation compared to the long axis of the couch and the long axis of the thigh, if it makes some angulation and the end field is found to be elastic, then there is tightness of the iliopsoas. In order to differentiate for the iliopsoas, we have to take it for further abduction. If with abduction the flexion goes on increasing, that means it is due to the psoas, because as the psoas is attached to the transverse processes and it is bit coming inferior and lateral. So when we are taking for further abduction, if the flexion restriction is becoming more, that means there is tightness of the psoas muscle. So in order to give the MET, now suppose here we find there is a restriction, we ask the subject to take your hip for flexion, just lift it up like this. From the barrier, lift it up, 1, 2, 3, 4, 5, 6, relax. Then we take to the new position, come on, lift it up, 1, 2, 3, 4, 5, 6, relax. Come on, lift it up, 1, 2, 3, 4, 5, 6, relax. For iliacus, we can put it in neutral position. If there is some restriction from here, come on, lift it up, 1, 2, 3, 4, 5, 6, relax. Go towards extension, come on, lift it up, 1, 2, 3, 4, 5, 6, relax. Then therapist is taking passively to the extension, lift it up, 1, 2, 3, 4, 5, 6. Muscular effort is 1/3, that is approximately 25 to 35% of the maximal effort. Contraction is held for 6 to 10 seconds and it is repeated for 6 to 10 times. In this same position, we can also check for the length of the rectus femoris muscle. So if we try to take the knee for flexion and if we are unable to achieve 90 degrees, then there is tightness of the rectus femoris. If the rectus femoris is tight, we can ask the subject to, from here you try to extend your knee very mild force you apply. 1, 2, 3, 4, 5, 6. Relax. Relax. Then I take towards flexion. Come on, do it. Extend your knee. Yes. 1, 2, 3, 4, 5, 6. Relax. Extend. 1, 2, 3, 4, 5, 6. Relax. Take to the new position. Come on, extend. 1, 2, 3, 4, 5, 6. Relax. Again, for the rectus femoris, in order to assess the tightness and in order to give the muscle energy technique, we have all those other method is also existing, but in this Thomas test position itself, we can check for iliacus, we can check for the psoas, and then we can check for the rectus femoris. In this same position, we can also check for the tensor fascia lata. So we can take the hip for the adduction, and if with adduction we find there is some restriction, if the knee is not coming to the midline, there is some restriction, then it could be due to the tensor fascia lata, TFL tightness. And from here we can ask the subject to try to bring your knee like this, in this direction. Okay, come on, do it, bring it. 1, 2, 3, 4, 5, 6. Relax. So he is trying to do flexion and abduction. I am restricting that movement. Once he is relaxing, I am bringing it for extension and adduction. Come on, take it up. 1, 2, 3, 4, 5, 6. Relax. Take to the new position. Come on, do it. 1, 2, 3, 4, 5, 6. Relax.